So I am entering my second year of my PhD in epidemiology um,
Great.
with Dr. Striley and Dr. Lopez Quintero. And
Hmm.
I am also a NIDA, National Institute of Drug Abuse T32 predoctoral fellow. So
Great.
non-COVID time, I'm doing a lot of work in substance use and older adults.
Okay.
But yeah, and during this whole process with COVID, they reached out to a lot of us grad students in
Hmm.
epidemiology and asked if we'd be interested in helping the state with the response. And so a lot of
Hmm.
friends and I decided, I mean, it's a terrible situation, but it's a great time for us in epidemiology to jump in because how many of us can say that we've helped out in a pandemic and had that experience? Um,
Right. Yeah, this is an invaluable experience for any student, faculty, researcher working on projects right now.
Absolutely. So, my friends and I are all throughout the state. I'm currently in Miami-Dade.
Oh,
And
wow. Okay. Are you streaming or recording from a hotel room?
yes, I'm in
Wow.
my temporary place, the Hampton Inn. I've been here. This is my third week.
Whoa.
Yeah. So it's been interesting trying to navigate through finals time for classes. We still have all of our classes.
Right.
So all of that's been happening from the Hampton Inn at night and then during the day reporting to the health department. So
Wow.
it's
So
been
walk us through that process here. So I mean, you're in the Department of Epidemiology.
mhm,
I'm in environmental and global health. So okay, so you're a student, right? You're still active.
mhm,
You're maintaining your caseload. So if you've
mhm.
been down there for 3 weeks, what was kind of the process 4 or 5 weeks ago about how you got to Miami?
So um, I yeah, they asked, it was a really quick process. Like it wasn't
Mm-hmm.
a whole lot of time to think about, we just kind of all said, yeah, we're interested. And then
Mm-hmm.
um, I think I sent in my like pre-hiring materials and within like 4 days I was
Uh-huh.
reporting to Miami-Dade. So there wasn't a lot
Wow.
of time to like plan ahead or anything, but uh, yeah.
So when you say they, was that faculty in the College of Public Health, or did the state of Florida contact UF, or like who kind of put the call out, and how did how did you end up in Miami?
So the state of Florida reached out to all grad students in Epi
Okay.
State. So
Okay.
here in Miami-Dade, I'm working with students from USF and FIU,
Oh, wow.
SU. So we have grad students in Epi from all different areas of Florida that have come together for this. And the state of Florida has managed to get us all in and helping really quickly, which has been,
Gotcha. Wow. Oh, that's exciting for like definitely like cross collaboration between different schools, right? You're meeting
yeah.
folks in different programs. I'm sure you're able to learn
Mhm.
like what methods were you trained in, to this point in your
Yes.
career and things like that. Well, that's unique. So I imagine everybody has their own room that's
Yeah.
maybe hopefully paid for by the state of Florida.
Yeah.
Gotcha.
Very
So,
lucky.
all right. So you got the call, you signed up, you raised your hand, said, I'm very interested in doing it. So,
Mhm.
you just had to pack up and move down to Miami. Were you assigned that location? Did you put in like, your preferred top three locations, or was it just, how did that work?
So they ask you to fill out a survey beforehand, just kind of asking your experience. And
Mm-hmm.
they said I could go to Broward County or Miami-Dade County. But I do have some friends that like requested certain areas. But for
Mm-hmm.
the most part, we kind of went wherever we were asked to go and
Oh,
wherever
wow.
at the time.
Right. And for those maybe less familiar with the state of Florida, the drive from Gainesville to Miami is no short drive.
No, not at all.
It's about what, 5, 6 hours, depending on
Yeah.
traffic.
But
So,
there's much less traffic when everybody's staying inside.
ah, very, the one of the very few appreciated silver linings in
Yeah.
the pandemic. So, okay, so how has it been with this transition of, I think there's multiple things happening here. You're responding to a very important pandemic and crisis that we're all going through, but you're also a grad student. So what have been like the major challenges that you've experienced, over the past month?
I would say that it's been trying to manage my time has been one of the things. We
Mm-hmm.
I know that each county is different, but here in Dade, we were told that we were able to work 8 a.m. to 8 p.m. Monday through Friday, and
Wow.
then to 2 on Saturdays and Sundays. And I know that's changing. Right now they're trying to do a little bit less, but that's a lot of hours for somebody who wasn't working at all before, and to try to put the
Right.
hours into your schedule during finals time,
Wow.
with 12 credits is a lot. So just trying to I was trying to find ways. Maybe I'll wake up early, and I started waking up at like 4:30 in the morning, doing a bunch of homework,
Mm-hmm.
and then going into the office. And then if that doesn't work, then maybe I'll try going into the office and then come home and at 8 and try to stay up for a long time and do work, because
Wow.
are still due, and assignments are still due, and you're still a student, and school still comes first. So just trying to find
Right.
to get all of that in.
That's really difficult. Yeah, it's got to be tough just for,
Yeah.
you're socially isolated. You if you go into the office, I imagine everybody has their own corridors they have to walk down or
Yeah.
something like that. So, all right. So you have that. So you're grad student, you have 12 credits,
Yeah.
and then you're being asked to work an additional 12 hours a day, 5 days a week, 7 days a week.
I mean, yeah, so they're really flexible. Luckily here, they're really flexible, which has made it a lot easier for me. So if I had said I have something I need to do,
Wow.
they're really flexible. Um,
Mm-hmm.
but I mean, it's also just another challenge was the content of, so what we're doing every day here is
Sure.
we're talking to the confirmed positive
Okay.
COVID-19 Miami-Dade residents.
All
So
right.
the kinds of stories that you hear all day, I mean, they're not the most some of them are okay, and some of the stories are a little bit sad. And so you
Mm.
listen to that all day,
Right.
and then you still, you have to do all the schoolwork. And so it can be emotionally draining.
Oh, I imagine. Holy cow. Yeah. Because I'm sure you've heard stories. Again, I have no experience with this of I tested positive, a family member tested positive, and that family member died. Right?
Yeah. Hmm.
That's probably
Yeah.
that's a story. Holy cow.
Mhm.
Well, I mean, has any of your coursework kind of prepared you for this kind of frontline, you know, communication piece with students? Had you had previous experience with communicating with families about these types of things?
Yeah, so I mean, I think so. I used to work at a health department before
Hmm.
I went back to school at UF. So I had some experience doing other types of work, but I've never really jumped in on the infectious disease aspect of things. I was more on the injury prevention side of things. So it's been interesting for me, and it's cool because you learn a lot of these things in class, but you don't necessarily see them in real.
Right.
And then you have times like this where I've identified that this lady is married to this person who works with this person who traveled with this person, and you can actually trace it through using onset dates and incubation periods and figure out exactly where it's coming from. And so
Wow, that's interesting.
that's really cool to be able to do that, and use those skills that we're taught in school. So
Yeah. So walk us through what would be a standard, if you will, day, and what's a basic protocol that you do with tracing the virus?
So we call all of so everybody in the county who has been tested positive will speak to somebody in the Department of Epidemiology
Mm-hmm.
at some point. And then from there, we reach out to them and we ask them a lot of questions like um, just basic demographics, questions like, do you know where you may have been exposed? What were
Mm-hmm.
your symptoms? We ask them about their health, if they've seen healthcare providers, things like that. And then there are obviously some that are more challenging, nursing homes are a huge thing right now.
Right.
So, tracking that down, making sure that like we have a separate team I have not participated in, but some of the grad students have, where they're actually going out to the nursing homes and making sure that they're best prepared to, stop the spread of the virus. So it's been really cool, to just be able to do that. And so, yeah, my whole day is pretty much spent, making calls, entering a lot of data, collecting.
Oh, sure.
And part of the job and part of like our training that's helped a lot is just kind of knowing the questions to ask. If it starts telling you stuff, they may just like end up spewing out a lot of really important information, and you have to kind of know like what to grab and like how to, like what's important to keep and what's maybe not as important. So.
And I'm sure your questioning has gotten better in the 3 weeks. I mean, day one, you're just like,
Yeah.
here's my list. And then I'm sure, just from talking to so many people that you're a pro now. You've been in the mix now for 3 weeks.
Yeah, it's a lot of calls in 3 weeks. A lot of, and here it's interesting. Something that we've come across is that a lot of people who are sent here maybe don't speak Spanish, and here in Miami-Dade, almost 2/3 of our population are Hispanic.
Oh.
So,
Gotcha.
Around different interviews for language purposes has been something that we've come across too.
Are you fluent in Spanish?
I'm not.
Okay, so that presents another interesting barrier to getting accurate data.
Yes, absolutely.
So, okay, so you've been down there for 3 weeks. Is this the end of your third week then?
Yeah.
We're recording on Friday, April 24th, 2020. So you're finishing up your second year.
Year. Yeah.
Or ending your first year in the PhD program. So what does the next month look like? Are you going to be down in Miami over the summer, or what's your future look like?
So for me, I have one more week, and I've decided to go back to Gainesville, and to focus on school, but also there's a team of us that are helping out. I know you're interviewing Journey Shapiro. She's leading those efforts, and so I'll be joining in with her.
Oh, great!
Out for Alachua County and being able to do it from home. So.
Yeah, so you've been away for going on a month now, and that's of course preparing to go down. That is obviously stressful and everything. So with this webinar series, the theme is workplace connectedness. So what have been the challenges from like a wellness perspective when it comes to having good collegiality with people and being there by yourself? Like what have been the challenges and things you've learned now that you've been in the field for a month as it relates to wellness?
I think that like there's a lot going on given that it's a pandemic, and then add that you're in grad school, that adds some stress and some hardships. Right. You add that you're responding to a deployment, and then that adds even more. And so I think for me it has been just like allowing myself to be patient with myself, and understanding that like there's a lot going on, and that it's okay if I'm not like 100% all the time. I give what I have, but there's just a lot going on, and everybody's just got to do the best that they can. And so I think able to look back and say like, well, I did what I could.
Yeah, I think that's a great way to look at it. It's a good positive, way to think about things for sure. Because it's we all the days start to run together, and there's not any one thing probably that can make what's better in today's days. What's right, normalcy is going to be different. But I mean, if you could think of anything that would make these transitions going back to Gainesville or your current work, I mean, could you name anything that would make any like red flags going off that say like, if I had this this piece in place, this resource of support, I'd be better off?
I think one thing that's already helped me to be so much better off is that I have a really great group of friends that are also
great
in classes, and so we're all, and like even just, we'll have Zoom calls together, and
Mm-hmm.
it's really like sometimes it's for emotional support, sometimes it's for
Mm-hmm.
accountability. I'll say like, hey, I'm not being really productive, can we like study together? And so even though we can't be next to each other, we're still
Mm-hmm.
able to push through these hard times. So I think just
Right.
having that support and having really supportive mentors has been really helpful. And so just, everybody being supportive of each other, I
Yeah,
think.
that's great. Yeah, it's fortunate that University of Florida is a large program, large school, so your programs are going to be big. I would imagine it'll be tougher on the smaller epidemiology programs out there who may not have that support group, but maybe you've met new friends and colleagues, being in the field now. So I'm sure you
Absolutely.
catch up with those folks. So I just have to ask, do you get like extra course credit for being in the field, working, working so many hours, or, anything like that? Any benefits of other than boosting the CV, of course?
Well, the deployment, no. It is a paid temporary position, so we are getting paid. That is,
Oh, great. Phew. That's great to hear.
yes. Yeah.
We don't want the
Um,
free labor going down there.
but when I come back and I start working with Journey Shapiro, though,
Hmm.
actually offering a 1 credit field experience class, so that
Oh, very good.
get some. Yeah, we'll be able to, actually get to use it as a credit for field experience. So
That's awesome. So maybe we'll just
getting
kind of
those.
we'll wrap up on this last question here. So what has been kind of the most valuable lesson you've learned since being in the field? What's something that maybe you've maybe surprised to find out, doing the work that you're doing? Could be something technical, could be something more, something professional related. What's kind of the big lesson you've learned now that you didn't, know when you first went down to Miami-Dade?
Um, I would say I've learned a lot about how the community can come together during times like this.
Hmm.
It's easy to say that the community is divided by politics or whatever, religions, interests. But like when a pandemic like this occurs and people's health are really, of importance, then I've seen that the community has come together in a way that working here in Dade County, I didn't necessarily see before. Um,
Hmm.
People, when I call, they're not, like, oh, you're bothering me. They're like, oh, what can I do to help?
Oh,
Or
that's great. Yeah.
yeah,
I
or
imagine because you're kind of like a telemarketer in a way. You're just making lots of phone calls, but this is a
yeah,
little different.
yeah, exactly. And people are donating plasma and asking questions like that, and those are, it's good to see that the community can come together during something
Hmm.
like that. And so just learning how cohesive the community can be is really,
Hmm.
it's good.
That's great. Yeah. Well, thank you so much, Alyssa. I really appreciate all of your hard work, and I think we all can,
Mhm.
learn a little bit from all of our experiences. So, as it's Friday, I wish you the best, and have a great weekend, and we'll see you back in Gainesville.
Sounds good. Thank you.